All right, get ready to dive deep because today it's all about colon polyps. You sent us a ton of medical documents and handouts, so
You're really ready to get into this.
yeah, it seems like you are maybe prepping for a doctor's appointment? Or are you just super curious about this?
Either way,
Either way, we're going to try to make you a polyp pro.
you've probably heard that they're common.
Oh, yeah, definitely.
But get this, 30 to 50% of adults have them.
Wow.
And that
That's
means,
a lot of people.
yeah, statistically speaking, there's a pretty good chance that you listening right now have one.
Or more.
Maybe even more.
Yeah, that is kind of a mind-blowing statistic when you think about it. Suddenly polyps aren't just some abstract medical thing, huh?
Right.
But it is real. But before we all freak out, we should remember that not all polyps are created equal.
Absolutely. The vast majority are actually benign.
So not cancerous.
Exactly. Not cancerous.
Okay, good to know. So first things first, what exactly is a colon polyp?
So imagine your colon like a pipe, a really, really long winding pipe.
All right, I can picture that.
A polyp is a small growth on the inner lining of that pipe.
Okay, so it's like,
They come in different shapes and sizes.
oh, interesting.
Some have a stalk, almost like a tiny mushroom, while others are flat and spread out.
So it can be kind of like spilled paint that hardened.
Oh, that's a good one. I like that.
A little disturbing, but
Yeah.
okay, so if they're small and hidden, how are we supposed to even know if we have one?
That's the tricky part. Most polyps don't really cause any noticeable symptoms, especially in the early stages.
Especially when they're tiny.
Yeah, exactly, when they're small.
So how would you know?
That's why regular screening is so important.
Okay,
And especially colonoscopies.
so colonoscopy is kind of like having a tiny submarine
Yeah.
with a camera, going and exploring to make sure everything is as it should be.
Exactly.
Makes sense, especially with those statistics we talked about earlier.
hmm
But not all polyps are the same, right? I'm seeing some pretty complex terms in these documents here.
Oh, you're absolutely right. We need to talk about the different types
Okay.
because that's what really determines how concerned we should be.
And what the next steps are.
Exactly.
Okay, so hit me with the polyp knowledge.
All right, so let's break it down.
Is it like good cop, bad cop, and the one you really don't want to mess with?
Haha. Okay, not quite that dramatic, but let's bring it down.
Okay.
You have inflammatory polyps,
Okay.
which are often found in people with inflammatory bowel diseases,
Okay.
and those are usually benign.
All right, so that's one. What else?
Then we have hyperplastic polyps,
Okay.
small and common, usually not a big worry.
So those two sound pretty manageable.
Yeah, they're like little bumps in the road.
Little bumps in the road. Okay. What about the ones that we should be worried about?
The polyps that have the potential to become cancerous are called adenomas.
Okay.
And those are actually the most common type, which is why it's so important to get those regular screenings.
Okay, so even within adenomas,
There's different.
there are different levels
It's exactly.
of concern.
So we can break them down even further.
Okay.
We have tubular adenomas, which are the most common type, and they have a lower risk.
Got it.
But then you have serrated adenomas.
Serrated.
Yeah, and those can be a little harder to spot.
Oh, why is that?
They like to lie flat and hide out on the right side of the colon.
Oh, sneaky.
Yeah.
Okay, so serrated, why are those harder to see?
Their flat shape makes them harder to see during a colonoscopy.
Okay.
Imagine trying to spot a flat pancake on a plate.
Versus like a tall stack of them?
Exactly.
Oh, yeah.
Okay, that makes sense.
So you want to make sure everything's really clean for the doctor.
Yeah, thorough prep for the colonoscopy is key.
Absolutely.
Oh,
And speaking of concerning adenomas,
okay.
we can't forget about the villus adenomas.
Okay.
These are less common, but carry the highest risk of becoming cancerous.
Okay, so that's the one you don't want to show up.
Yeah, you don't want that one.
Uninvited.
Nope.
Okay, let's talk about the big C word then. Cancer.
How does a benign polyp actually turn into something malignant?
It's a process that usually unfolds over many years.
Really?
Yeah, think of it like a slow motion domino effect.
So slow.
Yeah.
That's good.
The cells in the polyp start growing abnormally,
Okay.
and they gradually change their structure over time.
So it's like a seed
Mm.
slowly growing into a plant. But if you catch it early enough,
Yeah,
you can remove that seed before it takes root.
exactly. Early detection is key.
Makes sense.
And that's why those biopsy results after a polyp removal are so important.
Oh, yeah.
So the pathologist will be looking for any signs of dysplasia.
Okay, now I'm guessing that word dysplasia.
Sounds scary.
It does sound scary, yeah.
Yeah.
It's not a full-blown cancer diagnosis, though, right?
That's correct.
Okay, good.
It's more like an abnormal pap smear result.
Okay.
So it needs attention and follow-up,
Yeah.
but it's not cancer.
But it could be.
But certain grades of dysplasia can progress more quickly than others. So that's why close monitoring is really important.
Got it.
Your doctor will recommend a personalized follow-up plan.
Based on what they find.
Exactly.
Okay, so dysplasia is like a yellow light,
Mm-hmm.
a caution sign.
Yeah.
Okay.
Things could head in a bad direction if you ignore it.
Yeah, definitely you don't want to do that.
Yeah.
So speaking of checking, how do we even find these polyps in the first place? It seems like colonoscopy is like the gold standard here.
It absolutely is.
Yeah.
It's the most effective way to visualize the entire colon,
Okay.
and that's key because polyps can pop up anywhere.
Anywhere along that pipe.
Yeah, along the lining.
You don't know where they're going to be.
Exactly.
Okay, so not only can we see what's going on
But we can often remove any polyps
at the same time.
right then and there during the same procedure.
Wow, so it's diagnostic A&D preventative?
Yes.
That's amazing.
2 birds, 1 stone.
Wow. Now, I know some people, maybe a lot of people, get a little apprehensive about colonoscopies.
Yeah.
What can you tell us about the procedure to maybe put some of those fears to rest?
It's understandable to feel nervous about any medical procedure,
Yeah.
but honestly, colonoscopy is a lot less scary than many people imagine,
Okay.
especially with all the modern advancements we have now.
What kind of advancements?
Well, first of all, you're given sedation,
Oh, okay.
so you're completely asleep during the procedure.
You don't feel a thing.
No, you don't feel a thing.
Okay.
And the doctors are very highly skilled.
That's good to hear.
So when you wake up, it's all done.
Oh, wow. Okay, that definitely takes the edge off. Speaking of expertise, I noticed your sources come from some really great places. The Center for Digestive Health and Nutrition
They're great.
and the Three Rivers Endoscopy Center, both in Pennsylvania. And get this, Three Rivers was actually the first freestanding endoscopy center in Western Pennsylvania.
Oh, wow.
They've been doing this for a long time.
They have a great reputation.
Yeah, so you can be sure you're getting reliable information from these sources.
Absolutely.
Okay, great. So we've covered what polyps are, the different types, how a colonoscopy can help prevent cancer.
Right.
But I'm curious, is there anything else we can do to lower our risk? What about family history? Does that play a role?
Family history is definitely a factor.
Okay.
If you have a close relative who's had colon polyps,
Like a parent.
a parent, sibling, or child,
Okay.
your risk goes up.
So if that family history is working against you,
Yeah,
does that change when you should start getting colonoscopies?
absolutely.
Okay.
So while the general recommendation is to start at age 45,
Okay.
if you have a family history, your doctor might recommend starting earlier, possibly at age 40.
Oh, wow. Okay.
Sometimes even sooner, depending on the circumstances.
So it's really individualized.
It's all about individualized care.
Okay, that makes sense.
Yeah.
And what about lifestyle? Is there anything we can do, any changes we can make
Oh,
to
absolutely.
kind of tilt the odds in our favor?
There are definitely some things you can do to lower your risk.
Okay, what can we do?
A diet that's low in fat and high in fiber is a great place to start.
Okay, so lots of
Fruits, vegetables, whole grains.
those good-for-you foods,
Yeah, good for you in so many ways,
including polyp prevention.
including polyp prevention, that's right.
So fuel up on those good-for-you foods.
Yes.
What else can we do?
Maintaining a healthy weight is crucial
Okay,
because excess weight has been linked to an increased risk.
got it.
And, of course, the usual suspects: avoiding smoking and limiting alcohol.
It's amazing how many health issues those same lifestyle factors are tied to.
It really is.
It seems like taking care of your overall health is a pretty solid strategy for polyp prevention as well.
It goes hand in hand.
Yeah. Okay, so healthy lifestyle, check.
Yep.
Regular colonoscopies, check.
So,
We're
great.
good to go.
Well, almost.
Almost.
While a healthy lifestyle can definitely lower your risk,
Yeah.
colonoscopy is still the most powerful tool we have
Okay.
because it's not just about prevention. It's about early detection and removal.
So it's a multi-pronged approach.
Exactly.
Healthy lifestyle, A&D, those regular colonoscopies
For the win-win.
for the win-win. Okay, before we move on to part 2, let's quickly recap what we've learned so far. Polyps are very common.
Very common.
Most aren't dangerous.
Nope.
And early detection through colonoscopy is key.
Absolutely.
But wait, there's more. We're just getting started. Join us for part 2, where we'll delve even deeper into the colonoscopy experience itself.
I can't wait.
Me neither.
Welcome back to our deep dive into colon polyps.
You know, I've been thinking about what you said earlier about a colonoscopy being both diagnostic and preventative.
Yeah.
It's kind of like a 2-for-1 deal.
Oh, I like that.
For your health,
Yeah.
it really highlights the value of this procedure.
Not only can we see what's going on inside,
Mm-hmm.
but we can often
fix it.
Yeah, address any problems right then and there.
So you're not just getting a sneak peek, you're also
Getting things fixed.
potentially getting things fixed at the same time.
Yep.
Pretty efficient.
Yeah, it is.
Okay, let's walk through the actual procedure.
Okay.
What can someone expect if they're scheduled for a colonoscopy?
So the first step is the preparation,
Oh, yeah.
which I know some people find a bit daunting,
The prep.
the prep,
Yeah.
but it's absolutely essential to ensure,
That the colon is clean.
that the colon is clean and we have a clear view
So we can see everything.
for the procedure. Yeah.
Right. You want to make sure those polyps
Don't have any camouflage?
don't have any camouflage. Right?
Exactly.
Oh,
So you'll be given specific instructions on what to eat and drink.
in the days.
Yeah, in the days leading up to the
I'm
procedure.
up to it.
And you'll likely need to take a laxative
Yeah.
to really clear things out.
So this is where all those legendary colonoscopy prep stories
Yeah.
come from.
Yes, the prep can be a bit
Intense.
intense, shall we say,
Yeah.
but it's temporary
Yeah.
and well worth it.
For peace of mind.
Yeah, for the peace of mind and the potential
Life-saving benefit.
life-saving benefits of the colonoscopy.
I mean, when you put it that way,
Yeah.
a little discomfort seems like a small price to pay
Absolutely.
to prevent cancer.
I couldn't agree more.
Okay, so you've powered through the prep.
Okay,
What happens on the day of?
so you'll arrive at the endoscopy center,
Okay.
and they'll get you comfortable in a private room.
Okay.
You'll change into a gown,
Okay.
and a nurse will start an IV,
To administer.
fluids and medications. Yeah,
Okay, so it's all about making you feel as comfortable as possible.
exactly.
Good.
And this is where the sedation comes in,
Oh, the good stuff.
the good stuff.
Okay.
So you'll be given medications through the IV. That'll make you feel relaxed and sleepy.
Okay.
You'll be closely monitored throughout the whole procedure,
Okay.
but you won't feel any pain or discomfort.
Is that good?
You're completely out.
It's like taking a little nap while the doctors do their thing.
That's a great way to think about it.
Okay, so what's actually happening during this little snooze fest?
So the doctor will insert a long, flexible tube
Okay.
called a colonoscope
Okay.
into your rectum.
Mm-hmm.
This scope has a tiny camera on the end
Okay.
that transmits images to a monitor,
Oh, wow.
so the doctor can actually see,
A lining.
yeah, the lining of your entire colon.
Wow, it's like a little mini submarine exploring your insides.
I love that analogy.
And if the doctor sees any polyps,
Yeah,
they can remove them.
right then and there.
You're
It's that
so-
tiny instrument.
Pass through the colonoscope.
Yes, through the colonoscope, exactly.
So it really is a one-stop shop.
Yes, it is.
Find it and fix it.
Find it and fix it.
I like it.
So the polyps are usually removed using a technique called a snare polypectomy.
Snare polypectomy. That sounds
A little intense.
intense, but kind of cool.
It is.
Okay.
So it's a very precise and effective technique.
Okay.
The doctor passes a wire loop through the colonoscope,
Okay.
loops it around the base of the polyp, and uses an electrical current to cut it off.
Wow, it's like a tiny high-tech lasso.
Yes, it is.
And then the area where the polyp was
Is cauterized.
to stop any bleeding.
Exactly.
So they're basically zapping those polyps out of existence.
Pretty much.
I like it. Okay, so the procedure itself seems pretty straightforward.
Yeah.
How long does it usually take?
Most colonoscopies take about 30 to 60 minutes.
Okay, that's not bad.
And after a short recovery period in the endoscopy center,
Okay.
you're able to go home the same day.
Wow, that's really good to know.
Yeah.
It's not like a long, drawn-out process or anything.
No, not at all.
So we talked about biopsies earlier.
Yeah.
What happens to those polyps after they're removed?
So they're sent to a laboratory
Okay.
for analysis under a microscope.
Oh, okay.
This helps determine the type of polyps
Okay.
and whether it shows any signs of dysplasia or cancer.
So that's where the real detective work begins.
Exactly.
Analyzing those polyps
Mm-hmm.
to see if there's any cause for concern.
And those results will guide the recommendations for follow-up colonoscopies.
Right, because the follow-up plan is going to be different
Exactly.
depending on what those biopsies reveal.
Exactly. So if everything looks good, you might not need another colonoscopy for 5 or even 10 years.
Oh, wow.
But if there are any concerning findings,
They might want to see you sooner.
yeah, your doctor might recommend more frequent screenings.
Okay, so it's a truly personalized approach
Yeah.
based on your individual risk factors
Absolutely.
and the results of those biopsies.
That's the beauty of it. We can tailor the recommendations to each patient's unique situation.
That's great. Everyone's different.
Mm-hmm.
Okay, so we've covered the prep, the procedure itself,
Yep.
and the importance of the follow-up.
Yes.
Anything else somebody should know before heading into their first colonoscopy?
It's natural to feel a bit anxious.
About the whole thing.
Yeah, about the whole thing.
Especially if it's your first time.
Yeah, exactly.
But remember, knowledge is power. Understanding what to expect can really help.
Ease those fears.
Yeah, for sure.
The more you know.
The less scary it seems.
Exactly.
Good point.
And don't hesitate to ask your doctor any questions you have.
Yeah.
No matter how small or silly they might seem.
It's your health.
It's your health.
You have every right to be informed.
Exactly.
And feel comfortable with the whole process.
You're in the driver's seat when it comes to your own health care.
Absolutely.
And remember, colonoscopy is a very safe
And effective.
and effective procedure that has helped countless people prevent colon cancer.
It's pretty amazing to think about the impact.
It really is.
This has had...
On so many lives.
Yeah, it's truly remarkable.
It is.
Okay, so we walked through that colonoscopy journey
Mhm.
from prep to procedure.
To follow up.
To follow up.
Yeah.
But there's still more to explore. What happens after the procedure? What kind of aftercare is involved?
Yes.
What kind of lifestyle changes might be recommended? And
Oh,
yeah, how often those follow-up colonoscopies should happen?
right.
Great questions. Let's dive into all that in part 3. Welcome back to our deep dive. We're in the final part of our exploration of colon polyps.
I don't know about you,
Yeah.
but I'm feeling a lot more knowledgeable.
Oh, yeah, me too. I
Yeah.
feel like I could teach a class on polyps now.
Almost.
We've covered so much ground from the different types.
To that colonoscopy procedure.
Yeah. And now we're going to talk about what happens after you wake up from that colonoscopy nap.
That's right, the aftercare.
The aftercare, lifestyle changes.
And those follow-up colonoscopies.
Yep, all the important stuff. So you wake up, you're a little groggy.
You might feel a bit disoriented.
Yeah.
It's like waking up from a really deep sleep.
I can imagine. Are there nurses there making sure you're okay?
Absolutely.
Oh,
You
nice.
wake up in a recovery area,
Okay.
and nurses will be monitoring your vital signs,
Okay.
making sure you're feeling all right.
Good, good.
Very gentle and reassuring.
Okay, good to know. So I have to ask, since they pump air into your colon during the procedure,
Mm-hmm.
do you wake up feeling like a balloon animal?
Uh-huh. You might experience some bloating and gas.
Okay, that's what I thought.
Totally normal.
Okay,
But don't worry, it usually passes pretty quickly.
good.
And you might also have some mild cramping,
Okay.
but over-the-counter pain relievers usually take care of that.
Okay, so a little bit of discomfort,
Mhm.
but for the long-term benefit of knowing...
Knowing your colon is healthy.
Yeah, okay. What about food? Can you go back to eating normally right away?
I wouldn't recommend diving into a big meal right away.
Okay.
It's generally best to start with clear liquids
Broth, stuff like that.
Yeah.
Yeah.
and gradually reintroduce solid foods.
As you feel better.
Exactly.
So maybe ease back into things with some toast and stuff.
Your doctor will give you specific instructions
Okay.
on what to eat
And avoid.
and avoid in those first few days.
Okay, makes sense. What about activity level? Can you jump right back into things?
Probably best to hold off on the marathon training for a day or two.
Okay.
Most people can return to their usual activities the day after,
Okay.
but it's best to avoid anything too strenuous for at least a day or two.
Okay.
Just give your body a chance to recover.
Yeah. Listen to your body. Take it easy.
Exactly.
Now, this might seem obvious, but you can't just drive yourself home. Right.
Oh, definitely not.
Okay. Good.
You'll still be feeling those effects of the sedation,
Right.
even if you feel awake.
Yeah.
Make sure you have someone to drive you home
And stay with you.
and stay with you for a while,
Okay.
just to be safe.
Yeah. Because those medications can take a while to wear off.
Yeah, a few hours to wear off completely.
Safety first.
Absolutely.
Okay. So we talked about the immediate aftermath,
Hmm.
but what about the long-term picture?
Yeah.
How can you prevent those polyps from coming back?
Good question.
Are we talking major lifestyle overhaul?
Not necessarily a complete overhaul,
Yeah.
but definitely some things you can do.
What can you do?
A lot of it comes down to those same healthy habits we talked about earlier.
The good for you choices.
Exactly.
No surprise there.
Remember that diet we talked about?
High fiber, low fat.
High in fiber, low in saturated fat.
Yeah, okay.
That's a big one.
For polyp prevention?
Yeah. Fiber really helps keep things moving
Okay.
through your digestive
It
system.
makes these things regular.
Exactly. And a high-fat diet can actually increase your risk.
Oh, so that's not good.
Oh.
Okay, so load up on those fruits and veggies and
Whole grains,
all that good stuff.
all that good stuff.
Delicious, Andy. Good for you.
Exactly.
Awesome. And don't forget about exercise, right?
Yes, exercise.
And to stay active.
Staying active can help reduce inflammation in the body.
Okay.
And inflammation
Can lead to...
has been linked to polyp development.
So it's all connected.
It's all connected.
Okay, so food, exercise, all those good habits are crucial.
Yes.
But what about those follow-up colonoscopies? How often do you have to go back?
That's where things get a little more personalized.
Okay.
It really depends
On what?
on a few factors, like
Yeah.
the types of polyps that were found,
Yeah,
their
okay.
size,
Yep.
and whether they showed any signs of dysplasia.
Those precancerous changes.
Exactly.
Okay, so it's not a one-size-fits-all?
No, not at all.
You work with your doctor to come up with the best plan.
Absolutely. Your doctor will consider all those factors
Wow.
and recommend the best follow-up plan for you.
And of course, if those polyps were precancerous,
Yeah.
then you're going back more often.
More frequent screenings are definitely recommended.
Makes sense. You want to catch those early.
Exactly. Early detection is key.
Okay.
It's our biggest ally,
Yeah.
and it's all thanks to that colonoscopy.
Yeah.
This amazing tool.
I can literally save your life.
Exactly. It allows us to find and remove polyps before they can turn into something serious.
It really is pretty amazing when you think about it.
It is.
A procedure that can save your life.
And with the knowledge you've gained from this deep dive,
Oh, yeah.
you're armed with the information you need
To make good choices.
to make informed decisions about your own colon health
Absolutely. It's all about taking charge.
and being proactive.
Yeah, you're in control.
Exactly.
All right. You've given us so much to think about today. We covered everything from the different types of polyps
To the power of prevention,
to those colonoscopies, the procedure itself, the prep.
everything.
I feel like I aced a polyp quiz.
Haha, I think you did.
Seriously, though, this has been an incredibly informative deep dive.
I'm so glad to hear that.
Thank you.
Remember, knowledge is power,
It is.
especially when it comes to your health. Stay curious. Keep learning.
Ask questions.
Don't be afraid to ask your doctor any questions,
Even if you think they're silly.
even if they seem silly.
Yeah.
It's your health.
You are your best advocate.
Exactly.
And before we sign off, I want to give another shout out to the Center for Digestive Health and Nutrition. Their website is an amazing resource for anyone who wants to learn more about digestive health, with tons of information, articles, even recipes. It's all there.
So big thanks to them for all the great work they do.
Yes, thank you. On that note, we'll wrap up this deep dive. A huge thanks to our expert for sharing their expertise.
Oh, it was my pleasure.
And thank you for joining us on this journey.
Yes. Thanks for listening.
Remember, your health is a precious gift. Take good care of it.